Do not have prepared comments this morning. I do just want to give a shout out to all of our Pitt County Health Department staff, from my director of nursing on down, who are working our testing sites out there in the heat. They are doing a fantastic job. As of this morning, we had tested in excess of 2,155 people. So we are just kicking it out of the park in our testing program, far above what we had anticipated doing. So shout out to all our staff, and want to make sure that good people of Pitt County understand how great a health department they have, and very proud of our workforce and the job they're doing. So happy to take your questions.
So, Dr. Silvernail, do the changing seasons seem to have any kind of impact right now on COVID?
I wish I could say yes. There is some thought that the warmer weather might knock COVID down. But then the other side of that is when it gets hot, people congregate inside in the air conditioning. So if you're outside on a day like today, the risk of transmission is very, very low. The sunlight, the heat, the relative humidity are all going to combine to make the time that virus can persist outside of the body very short. But when you go back inside in the air conditioning and you congregate and to watch Netflix or whatever, that the transmission certainly in that environment is more likely to occur.
Yeah, that kind of goes into my next question with like mindful social distancing. You mentioned, if you're gonna be getting together and socializing, how do you do that in the correct way that you really are going to be cutting down on the transmission?
Yeah. If you think about, if you're going to have a backyard barbecue, have dedicated servers, make sure that the serving stations are spread out by at least 6 feet. Try to have people sit 6 feet apart. Obviously, you can't eat with a mask on, eat or drink with a mask on. But we have seen, as I mentioned in my letter yesterday, we have tracked some cases where people have gotten together and hung out and thinking that they weren't sick, and lo and behold, somebody had it, and now we have a little cluster from a barbecue or from eating chicken wings and playing video games together and those kinds of things. So we do ask people to try to be mindful of that, to maintain that social distancing, to maintain all the hygiene things that we've talked about, so that we reduce the transmission and impede the transmission of this virus where able.
And can you give any insight right now on babies or younger children now contracting the virus? I know that I saw one study that 80 babies were tested positive. So is there any insight you can give on that?
I saw that. We continue to believe that children, for the most part, are at very, very low risk from the virus. There was a story in the press, a study that suggested that children might actually be a virus sink, meaning that they get the virus but don't pass it on, kind of like a heat sink, in an electronic device. And whether that's true or not is yet to be determined. Many of these studies are small and may or may not be reliable, even if they seem to be reliable at this time. But there's some estimate that the children may be less efficient at spreading it. Certainly, on average, the healthy school-age child to middle school, high school-age child, very, very low risk from the infection. And to my knowledge, at this point, there has not been a death in North Carolina below the age of 25. So, with the potential for schools reopening in some capacity, I feel that while there may be clusters of cases, there's unlikely to be harm from those infections.
And you mentioned in your letter about a COVID committee. Can you just talk a little bit about the goal of that committee and really what the mission will be?
The goal was to bring some of our county leadership together. There'll be a couple of county commissioners on that. There'll be myself, my deputy director, perhaps some other health department staff, and some community leaders there to look at how we go forward and live with COVID. Obviously, we have to follow the governor's order. We can't do anything that's outside of the governor's order. But hopefully, eventually, that governor's order is going to be lifted, and we want to make sure that the tools are available and in place to help our business, help our community to live safely with this virus, so that someday this can be just another potential infection in the cause of a pneumonia or cold kind of thing.
And when it comes to the compact study, how will that help the health department? And would you encourage people to reach out and participate in this?
Absolutely. We want to get as big of a sample to participate as we can. The more people that participate, the more valid that data is. And then from that data, there'll be a subgroup drawn for serial testing and serial surveys to help track the spread of the virus over time in the community.
Is there any requirements for people in order to take it, or is it just open to anyone?
Open to anyone that's in the community when they randomize and select that follow-up cohort. That'll be done by the ECU folks. But in the initial study, anybody can participate in that initial survey.
Any new symptoms that you think are important to note right now and kind of track as the virus continues to kind of change things coming up?
I think the hallmarks are still fever and cough for most people. In younger populations, the symptoms seem to be milder and more short-lived. So we are seeing folks that have they have some generalized body aches for a day or so and feel better. Sore throat, again, in younger populations seems to be a common symptom. We're also finding a fair number of folks that have no symptoms. And that's the hard one because they're the ones you can't identify unless you test them. But the fever, cough, big ones is the big symptoms, and then generalized body aches or some just sort of an ache that you don't have an explanation for. If your back hurts and you didn't do anything to make your back hurt, could that be COVID? Maybe. So those things come out. Sore throat seems to be a common complaint.
And we're still seeing some people that are refusing to wear masks. So as a health expert and also as someone who lives among the community in Pitt County, what would you say to anyone that really still refusing to put that mask on?
As I said, there are some people who can't wear a mask, and for various reasons, whether they're claustrophobic or have breathing problems. So I understand that. But for those of you that live in our community and in Eastern North Carolina in general, if you can wear a mask, please wear a mask. You may not know that you have the infection, and it will help you keep you from spreading the infection. It may offer some limited protection to you if you don't have it and you meet someone who does. So I think it works both ways. I know it's one of the great flip-flops of this. I'm frustrated with that too. 3 months ago or 4 months ago, I was standing here telling you not to wear masks. So, but the data does show that it does reduce transmission. There was a publication in the what's called Morbidity and Mortality Weekly Reports, MMWR, that looked at a hairdresser. 2 hairdressers that were infected but wearing masks. Their customers were wearing masks, and in 137 interactions, there was no transmission because the infected person and the uninfected person were both wearing masks. So, I think there's data to support that wearing masks can reduce transmission.
And my last question for you is, can you just reiterate, right now, if you're sick, if you're not feeling well, how important it really is to stay home? You don't want to kind of power through anything because it seems like there's just too big of a risk to do that.
Yeah, please, if you are sick, please stay home. Get yourself evaluated. If you want to be tested at one of our testing sites, you can be tested at one of our testing sites. You can be tested through your personal physician or urgent care or through the ED if you're sick enough to go to the ED. But please try to avoid other people if you're sick. And I hope that's one of the things I hope lasts in the post-COVID era. We have people who go to work when they have flu and other infections, and sometimes it's just better for everybody. If you're sick, stay home. You're welcome.
There has been some optimism among individuals that will have a vaccine by the end of the year. As that starts to roll out, if that's the case, can people kind of ease up on their precautions, or is it something that until we get everyone vaccinated, until it is widely available?
Yeah, in terms of stopping the virus or impeding transmission, we would need something on the order of 60 to 70% of the community to have been either infected or vaccinated. Even in New York City, when they did surveillance after the peak of the crisis in New York City, only about 20% of the residents in New York City had evidence of COVID infection. So I think even if a vaccine becomes available late this year or early next year, it's going to take time for that to get distributed and pushed out into the community. So until a fairly large portion of the community has been vaccinated, we'll need to continue with some social distancing, masking, and enhanced hygiene or increased hygiene measures.
I know you mentioned that children are among the lowest risk population, but as we move into schools, perhaps in person, requiring masks, is there anything you
Mhm.
why, over the summer they didn't.
Yeah, I think if you talk to them about germs and how germs are spread by coughs and sneezes, and that the mask can catch your cough and sneeze so that your germs don't get to somebody else, can help children understand that. Obviously, with younger age groups, it's going to be a little bit harder. As kids get bigger, that battle becomes easier. And then the idea that you need to just stay more than a arm's length away from your friends can help. But it is challenging with the younger age groups, and that's where we're talking to them, and maybe some simple cartoons and things like that can help. Right? Any other? Name? Anything else that you think I should mention this morning? Yep. August the 14th is our projected end date. And then we'll look at our budget, look at the data, and we will probably continue some testing at the health department at least. Most of our sites are schools right now, our Pitt County schools. So when the schools reopen on the 17th, we're going to lose access to those sites. So we'll need to reconsider how we do that testing. And we'll see what the demand is and what our numbers look like. I guess the one thing I would like to say, because you didn't ask me about case counts this morning, is that, with influenza, we count influenza for a certain period of time, and then the next year we start over. With COVID, we're really still in that first wave, so we haven't stopped counting cases, but we know that many of our cases have recovered. So right now we're a little bit over 1,200 cases in Pitt County, and I haven't seen the recovered count for today yet, but we're probably 900 or more. So about 3/4 of our cases would be recovered. So really anybody who was infected in March, April, May, and now June would be recovered. And we're far enough into July that folks that were infected in the first week of July are likely recovered, or at least would have cleared the virus, the active virus infection. So we have probably something on the order of about 300 active cases in a population of 185,000 that we can identify. Now, there may be more that we can't identify, but what we can identify, 1,200 and probably 900 of those are recovered. So almost about 3/4 are recovered.
That just led me to one more question. And, in this time of we have more accessibility to get tested, are you still encouraging people to just get tested just so we know and that, asymptomatic cases and things like that?
Yeah, we did. One of the conditions the commissioners put on this or requested was that there be no criteria for testing, essentially, that if an individual wanted to be tested, they could be tested. And so we will test anybody that presents for testing. You're welcome. Okay. Mm-hmm. Mm-hmm. Yeah. That, mm-hmm. Mm-hmm. Yeah. One of the unintended consequences of the response to COVID has been, we know that there are decreased screenings for colon cancer, decreased screening for breast cancer, prostate cancer, things like that. So we don't want people to put off needed health care. We also know that well-child checks have been deferred, so kids haven't gotten their well-child exams. And the thing that's tied to well-child exams that's even more of a concern is vaccinations. So many of our kids are now behind on vaccinations because their well-child care has been deferred by COVID. So important that we get that in, and we're going to work to help get that done. But we'd also encourage them to try to get those well-child checks caught up with their medical home if they have a medical home.
Yeah, can you reiterate how that's definitely important as we approach to the upcoming school year?
Mm-hmm. Yeah, we certainly don't want to see outbreaks of other diseases in schools. So our vaccination rates for measles and things like that are pretty good, but we'd hate to have a case of measles. Kids get vaccinated for pertussis. We don't want to see pertussis cases in the schools, things like that. And then even influenza, having that influenza vaccine, which isn't required for school, but is a good idea for anybody who has no reason not to get an influenza vaccine. Because, when flu comes back around in the fall and winter, well, do I have flu or do I have COVID? It'd be unlikely that you have both. Is it possible? Sure. But most people aren't unlucky enough to get 2 infections at once. But then it becomes a confounder, and then we've got to test you for multiple things. And some of our testing will probably involve so that we can test you for multiple respiratory diseases at once. But we're not quite there yet. Okay, great. All right. Thank you, guys. Appreciate your time.